Have you back. This is the South African Morning. So Hendrietta Stockdale Nursing College is on the verge of being closed, and if that happens, it would mean there will be no training facility in the entire province. But the Young Nurses Indaba trade union says it's in a total state of dilapidation. It's calling for urgent government intervention to save this college. Lerato Mthunzi from the union joins us now to discuss this. Lerato, always a pleasure having you right here on the show. Thank you so much for your time. How did this college, the Hendrietta Stockdale College, even get to this point? I mean, surely if it faces closure, it means it's been months, if not years, of dilapidation, of infrastructure breakdown. In your view, how do we get here?
The college itself is one of the first colleges in the country. In fact, the first college to be registered and recognized to do training since way back in 1887. So it is quite an old building that actually had to be closed down. And as a temporary measure, the Northern Cape Department of Health put up couples or containers as classrooms as a temporary measure. But this measure has been there for years. We've seen the Northern Cape obviously neglecting to erect an infrastructure that will house education and training of nurses in the province, and it's been like that for the longest. Unfortunately, it's not just the infrastructure of the college that is a problem. Even where students, residents are concerned, we know there's a building that has been in motion since 2005. To date, that building has not been finished. So those are the things that the accreditation bodies are looking at: the infrastructure, the material resources, which this college, it will sound like I'm exaggerating, don't even have a toilet, a proper toilet, not even a toilet paper. So it's really in a bad state, electrically, in terms of plumbing, in terms of the day-to-day running of the college is just extremely bad. So this is what we are looking at, and it's something that needs the Northern Cape Department of Health to really be nudged strongly. But also not just the Northern Cape Department of Health. The South African Nursing Council has been accrediting this college year in, year out in this particular state. Now that we are transitioning into higher education, the Council of Higher Education is saying, unfortunately, this cannot be accredited. This is not what we can have our higher education student being studying under, and we agree with them.
Right. So what are then the consequences? I mean, we're seeing some of the visuals on our screens right now as you talk, Lerato, and definitely there was no maintenance in that infrastructure. If you speak of there being no toilet or even toilet paper, we could see that is no place for any nurse to receive their training or any institution to conduct their training. So if it closes down, then what's the consequence of this? It being the only sort of like infrastructure within the entire province of the Northern Cape?
We've actually sat with the DG from the Premier's office together with the HOD that is acting in currently in the Department of Health, and we've managed through this intervention to go through some buildings that are existing within the province, but also the hospital, the big hospital, Robert Mangaliso Sobuka Hospital, used to house nurses, not just for college purposes, but also for residential purposes. And we are saying, let's relook at reinstating what needs to be there. This is not definitely the building that we want, but as a short-term measure and purposes of accreditation, perhaps those are the areas that we can look at. So we are exploring all those avenues. But what would actually need to happen from now going forward is the commitment and the political will, which has not been in existence, and obviously allowing the college to be autonomous. The college is controlled, cannot even procure a cartridge or a printer. They don't even have a library, no internet. So these are just basic things that any other college has, but in Northern Cape, in the nursing lingo, where you can't access something without going through hoops and loops for you to get it.
Yeah, and then one would wonder the quality then of the training within that college, if indeed it was thorough. If you're saying there were no printers and we're talking of nurses here receiving their training, I mean, these are people that are supposed to receive training that is meant to save lives. Did they have the necessary equipment to receive that training? One just has so many questions around this, Lerato. And as you answer this question, what then happens to the nurses? What alternatives in the meantime, in the interim, as you continue to engage with government as well as the higher education Education, the Council of Higher Education. What happens to them and how many are there? How many nurses then are we talking of here?
The college is currently having a legacy students who are about 143 in 2 different levels in 3rd and 4th year. And the measure that we've asked to be put in place is to be able to occupy lecture halls or auditoriums of nearby facilities, which is the hospital, so that learning can continue. But we've all agreed together with the department that this place must be closed because it is it's an occupational health and safety hazard. One, but also we are saying they have not been able to train the new qualification that has been accredited like any other nursing college. So they don't have a new intake of the new course. And what it actually means, it means the province and the community of Northern Cape faces to not have any form of production of healthcare workers in the near future. And it actually means that the healthcare system that is already in a very dire state will actually be severely impacted worse than it is currently.
All right, well, we'll leave it there. I appreciate you speaking to me this morning about this quite concerning. General Secretary of the Young Nurses Indaba Trade Union, Lerato Mthunzi, painting that grim picture of the Hendrietta Stockdale Nursing College, understanding, Gareth, that, of course, at this point, that is no place for any nurse to learn. As a matter of fact, quite concerning is even when the learners and the nurses were receiving their training, if those were the conditions we're seeing, just in terms of infrastructure, and team, if you may just please pop in those visuals just once again as we discuss this briefly, if those were the images that we're seeing in terms of no toilet paper working, the building looking like it's falling apart, what is the quality of the training like inside?
What's the quality of the medical equipment?
The medical equipment
that they're supposed to be training on.
That's right. There you go.
That's also what has to worry us, because these are future nurses as well. So we're going to stay on top of this story, because it's a big issue, especially if it's the only one in the Northern Cape. We need all the nurses through the system, highly trained as quickly as we can. So very, very worrying. We will stay on top of that story when the gate even locked as well. We'll stay on that for you. Let's head over